is my discussion, my video for discussion board 2, uh, talking about suicide assessment tools. And when I suspect my client is in danger to themselves, I would keep my student in a safe environment and have them complete the suicide risk screening tool offered by the National Institute of Mental Health to determine the extent of their self-harm. If they are at risk of suicide at that moment, in either case, I would contact the parents. But if they were at risk at that moment, then I would not leave the child alone, the student alone. And I would contact parents, and if I couldn't reach parents or guardian, I would contact law enforcement. Well, the student response officer on campus or the school psychologist. An effective screening tool that I found was the ASQ, the Ask Suicide Screening Question Suicide Risk Screening Tool. Some teen suicide risk factors are a recent or serious loss of a family member, friend, or a pet, separation or divorce of parents, a breakup with boyfriend, girlfriend, a psychiatric disorder such as depression, trauma, stress disorder, prior suicide attempts, students who are struggling with sexual orientation in an environment that is hostile to that orientation, a family history of suicide, and lack of social support or bullying in the classroom. According to the National Institute of Mental Health Suicide Risk Screening Tool, questions to ask a teen that I feel may be at a risk of suicide are: in the past few weeks, have you wished you were dead? In the past few weeks, have you felt that you or your family would be better off if you were dead? In the past few weeks, have you been having thoughts about killing yourself? Have you ever tried to kill yourself? And if so, when? Are you having thoughts of killing yourself right now? And if yes, please describe. I chose this assessment because it was short and to the point. When in this situation, asking about a risk of suicide might mean that this student is at immediate risk, and a long drawn out assessment might find the student not wanting to complete it. I did like the Risk Suicide Assessment C, SSRS, by the Research Foundation for Mental Hygiene, because it seeks out the intensity of the thoughts and feelings of suicide. The suicide assessment tool that I chose lacks the questions on intensity, but the other one asked to what degree, and I thought that that was really beneficial. But I think in the moment that I'm trying to assess whether this is a danger right now or not, that I would use the screening tool that I chose, the ASQ. But having done that, and finding that the child is not at immediate danger, then I might assess with this other tool to determine the degree of risk that they're at. The school system where I am interning right now is adopting a suicide prevention program. It's the QPR training through QPR Institute. And QPR stands for Question, Persuade, and Refer. We've had one training thus far, with others happening in the near future on professional development days. Typical crisis protocol would be give assessment to student, contact parents or guardian, do not leave student alone, and refer to a mental health provider. And the assessment from the National Institute of Mental Health would determine if my student was at risk at this moment. And I think that that would be beneficial for the student. Again, I do like the other one that test the degree of intensity. But I really do believe that in that moment, if I think there is a high risk, that I'd want something short and to the point. And that's it. Have a great week.